Hey there, Sono Peeps, how's it going? Today we're going to go over the pelvic ultrasound protocol. So this gynecological exam is transabdominal. I'm going to go over the transabdominal or transvesical approach today. And then next week I'm going to go over the endovaginal or transvaginal approach, which usually gives you higher resolution, much nicer images. So I begin the exam. Now, another caveat, as usual, every place you go, you're going to do your protocols slightly different, but they're all going to have the same basic pictures that you need to get in order to complete the protocol. So I begin sagittal midline. One thing you're going to want is to have the patient's last menstrual period. That's good for telling what phase the endometrium should be in, and also for pregnancy purposes. So I begin sagittal midline. Here you see the bladder is filled. This is the fundus. You got your endometrial stripe right here, cervix, and your vaginal canal. Take that image in midline. Here's another image in midline with the endometrial stripe slightly clear. Then you can measure the endometrial stripe. This one's measuring about 0.76 or 8 millimeters. Here you can see I'm over measuring slightly a little bit. Typical endometrium is usually under 16 millimeters. So once you're done with that image, usually what I do is I'm in sagittal midline. I like to take my measurements right there. I'll do a dual screen and get my measurements. So you got your length, height, and width right there. All right, this is around the level of the fundus. And you get your measurements. So that's about 8.3, 3.2, 4.4 with about close to 60 milliliters or 66 cc's in volume. Okay, so once I'm done with that, I want to angle to the right lateral, and then a little further to the right lateral. And then when I'm done with that, I go to the left lateral, and then a little further lateral. Always want to check for fibroids, look at the myometrium, make sure that that myometrium is homogeneous, that they don't have any adenomyosis. All right, so once I'm done with my sagittal images, I go to transverse. I begin all the way inferior at the vaginal canal. Here is the vaginal canal right here. The cervix would be right above this. Here you can check for fluid. If they have hematometroculpus or hermatoculpus, you'll see that there. You also see it in sagittal. So once I'm there in the transverse vagina, I start to sweep upward towards the cervix. So there's your cervix. In this area, also in sagittal, you'll see if they have any Nabothean cysts, which are very common. All right, so a little further up, here you can see the body of the uterus. Here you got your right ovary and transverse. All right, and now towards the fundus of the uterus, you can see the endometrial stripe there. In some cases, you'll see it much more clear, especially in endovaginal exams. All right, so I'm done with my transverse images. Then I want to begin in the right. Then I want to begin to the right adnexa and look at the right ovary. So I take my right ovary in sagittal. Here's your right ovary in sagittal. You can see little follicles. You're going to see several follicles. And you might see a dominant follicle on one or the other. It appears like a cyst. Anything under 3 centimeters is normal, physiological. You can call it a dominant follicle or a physiological cyst. A lot of times women get gynecological ultrasounds and they'll measure a 2 centimeter follicle and they'll say, oh, you have a 2 centimeter cyst in your ovary. And then from then on, their narrative is that I suffer from ovarian cysts. And they'll come to the department and they say, oh, they did an ultrasound somewhere else and they said I have cysts, and that's going to be their story forever. I have ovarian cysts. So I like to educate the patients that I get and tell them what's normal and what's not. You may also have corpus luteum, which will have increased blood flow around. Many times that's mistaken for the ring of fire, which is which you can see in an ectopic pregnancy. So there's a lot of things to educate ourselves, our colleagues, patients, and radiologists as well as to what's normal and what's expected in a normal pelvic ultrasound. So you got your sagittal image there with follicles. Once I'm there, I like to do a dual screen and just measure my sagittal and transverse. So again, length, height, and width. Here you got 3.6, 1.6 by 2.3, and about 7 cc's. All right, so normal looking ovary. You see the little follicles. All right, then I like to put color Doppler and pulse wave Doppler. Now, this is not required in many places. The ovary does have a dual arterial supply from the iliacs and the uterine artery. So having blood flow in the ovary does not completely exclude an ovarian torsion, but I like to do this anyways. If you have an ovarian torsion, you're going to see it. One ovary is going to be much larger than the other one. It's going to be echogenic. It's going to have peripherally displaced follicles. All right, so that's something to keep in mind. But with my protocol, I like to put color Doppler followed by spectral wave Doppler. I really don't measure the velocities or anything like that. I just show the physiological arterial activity. It's especially for the ER where I work, they just like to know that there's blood flow to both ovaries. It gives them peace of mind. Okay, once I'm done with that, I go to the transverse ovary. There you can see the ovary and transverse, very beautiful. Again, you can see the little follicles. All right, and that's it. Once I'm done there, also when you're looking at the ovaries, you want to make sure, you want to look for lesions, teratomas or dermoids, ovarian cysts, anything larger than 3 centimeters. Anything larger than 5 or 6 centimeters increases your risk of ovarian torsion. So it's good to notice those things. Many times you're going to see hemorrhagic cysts. It's good to know what endometriomas look like. Just keep all those things in mind. Also ovarian torsion. Okay, then I go to the left adnexa and I look at the sagittal left ovary. There you see it again with many little normal looking follicles. Very pretty looking ovary. Again, when you do an endovaginal exam, the resolution and the images you can get in the ovaries are just astounding. So keep that in mind. Then I like to measure. After I get my sagittal image, I'll measure length, height, and width. This one's 3.9 by 1.9 by 2.1 at about 8.2 milliliters or cc's. Then I like to put my color Doppler. There you see the blood flow. And spectral wave or pulse wave Doppler. So once I'm done with that, I like to take my transverse images. There's the ovary and transverse. Very pretty. And that's pretty much it. So that's the entire protocol. It's a very simple exam. We do a lot of these, especially if you work in a hospital that has an ER. You're going to do a ton of them. All right, so don't forget to check for free fluid in the cul-de-sac. Oftentimes you're going to see a tiny bit of free fluid, a mild bit of free fluid. That's normal. It's considered physiological. Nothing to worry about. It's a very straightforward exam. I hope you found this useful. Again, I'm going to go over the endovaginal protocol next week. Hopefully I'll get some nice images there to show you guys. And that's it. Don't forget to click the subscribe button, hit like, hit that little notification bell, do all those YouTube things that you got to do. And see you next time. Bye.